Good morning and welcome to today's DHHS Inclusion Works CIE Incentive Program webinar. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. To ask questions, use the chat feature or click the hand icon located on your control panel, and we will answer as many questions as time allows after the presentation. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. We kindly request that you refrain from using AI note-taking apps and devices. This presentation and recording will be posted on our Inclusion Works website after the webinar is complete. At this time, I'd like to turn it over to Claire Colligan, IDD Consultant for Competitive Integrated Employment for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thanks, Tina. Good morning, everyone. My name is Claire Colligan. I am the IDD Employment Lead for DHHS's Division of Mental Health, Developmental Disabilities, and Substance Use Services. I'm very excited to be here today. We're excited to tell you more about our Inclusion Works projects and especially about our new incentive program. I would like to introduce you as well to Austin Glass from our project management team and Mike Chapman from UNC. Mike, would you say hi?
Hi, everyone. I look forward to talking to you a little bit later in the presentation. Claire?
Thanks. Austin?
Hey, Claire. Thanks for introducing. As she mentioned, I support the project management and reporting activities, and I'll be talking later about data collection.
Thank you, Austin. So I'm going to take a minute and go through our agenda for today. We're going to share with you more about Inclusion Works and what we are accomplishing right now. Austin's going to tell you a lot more about the data that you provide, which helps us understand what's happening in our community, and also about how our work can help everyone in the state. We're going to be talking about our incentive program and what we hope to accomplish with that program. Mike is going to tell you more about employment assessments we're conducting, and there will be time for questions and answers at the end of our time this morning. So let me start by giving you a little bit of an overview into our Inclusion Works project. If you see on this slide, you see that we have competitive integrated employment, and it is a collaboration with all of our various stakeholders in the state. Inclusion Works is a department and a system-wide approach to CIE for all people with IDD. Our mission is to expand CIE and improve the delivery of CIE for people with IDD in North Carolina. We want to make sure that we have input from all of the stakeholders involved. To help people work in settings that they choose, we want to make sure that our mission is delivered in a certain way. We want to ensure that individuals with disabilities have more choices and options. We want to support providers to update the tools and processes that they use to help individuals with employment. And we really want to partner with community services, including ADVPs and ILOS, to support individuals with IDD and contribute to a meaningful week. As you can see, everyone together helps us improve and expand supported employment services to get to increasing CIE for those who want to have CIE. And next slide is Mike. If you could tell us a little bit more about Work Together as a partnership.
Yep. So as a part of this partnership, the division put out a request for action and asked people to be a part of this. And as one of those people that applied was Dr. Brianne Tomaszewski. She runs the Work Together NC website. If you have not been there, I encourage you to go there, but she's also one of our main researchers. So we have Work Together NC is leading this project, but we realized that we weren't the only ones that could be members of it and do a good job. So we invited some other partners on board. And of those partners, we have the Triangle Disability and Autism Services, as they are very aware of services in the state of North Carolina and what it takes to be a quality provider. And then we've also reached outside of our state to another partner called WISE. And WISE has helped other states and other entities reach the same goal that North Carolina is trying to reach as well. So everyone together is working to help make this a little bit better. Back to you, Claire.
To our supports and resources available. When somebody wants to work in a CIE setting and makes the choice to do so, in order to best accomplish this, DHHS collaboration with Work Together NC and WISE is to make the most important changes to our delivery systems to help make that happen. You can see here that some of the major areas that we are focused on. For strategic planning, we have to have enough stakeholders engaged. We have to have the important feedback that all of our stakeholders can give us. We have an ongoing stakeholder engagement committee, and maybe some of you have already signed up for this. With Work Together NC and WISE, we're going to have a really comprehensive landscape assessment. That's going to tell us where the gaps are and especially what is already working. All of this gives us the tools to develop an effective strategic plan and making sure that people have choice in how they spend their time. In a little while, Mike's going to tell us more about the structure of the employment assessments and the career development plans. These plans are going to be completed for all of the people currently in non-CIE positions across the state. These tools are going to be refined as we go forward and help make the process smoother, more effective for all of those who are working with folks. Providers are going to have the opportunity to be trained in completing the assessments so that everybody is able to have access to best practice. Our provider innovation part of this initiative is to give providers all the tools and training involved in helping folks get to CIE, if that is their choice. And this was actually the main reason we wanted to have this webinar today, is to talk about that. We're going to be looking at ways to help people innovate their service delivery and to bring customized employment to more folks and support self-employment too for those who are interested in it. We're developing a learning collaborative so that providers and care managers can help each other find solutions and best practice. And finally, we have begun collecting data to understand the employment landscape. Some of you have already been helping us along with that, and that help has been vital. We're gaining so much valuable knowledge. Our reports are going to be publicized so that you will have access to all of this information. And Austin, if you would like to talk more about data, that would be great.
Sounds good. Thank you, Claire. Next up, I want to cover some of the data collection updates for our Inclusion Works program and give some context before we go into the incentive program. So first, I want to start with a summary of some of the key data points that we're collecting for this initiative and why we report on them. I have seen some questions in the chat. All these materials will be sent out to attendees, so we'll make sure that you have access to them. So we rely on our providers to provide data on individuals who are currently receiving ADVP or ILOS services in the state, also sometimes known as LTCS, long-term community supports. These are services for individuals with IDD that are intended to provide vocational training, support, or in some cases, employment. We want to know the individuals who are receiving these services, and then also some specifics about their individual choices and their status regarding employment. Our goal is for individuals to find and obtain jobs in the community if that is their choice. So one of the first things we ask is if they are currently working in CIE. We also pull in data from supported employment claims and work with VR on their cases to pull in that data on case outcomes. We're also interested in individuals who are currently working, but not in a job that is considered CIE. So that's what we'll be calling non-CIE work or employed in a non-CIE setting going forward. We understand that some providers in North Carolina provide this type of employment at their facilities, and we're interested in those cases and knowing who is currently working in those settings. Lastly, we're also tracking informed choice and what reasons individuals may be making to decline to pursue CIE, as well as other services that they're using to make up their meaningful week. Lastly, we track demographic information, which includes location, what county they're in, age, gender, and other individual information that helps understand the total picture for North Carolina. So we combine all of those sources into our reporting, and it allows us to capture the current state of employment services in North Carolina. We use this information to inform our new strategic plan. So the data will help us make decisions about direction we can go in the state, knowing where there may be gaps in our current service array and how we should plan for the future of CIE work. And then lastly, we do want to highlight the progress that our community partners are making in the state. We know that North Carolina has some great providers who are doing amazing things for employment for individuals with IDD, and we want to call out all of those accomplishments. Next slide. So next, I want to spend a couple slides talking about the CIE data collection tool. So this is a spreadsheet that gets sent out once a quarter with questions about members who are currently receiving ADVP or ILOS services. We want to specify here that only those who are receiving the specific YP620 or T2016 service codes are listed in this spreadsheet. There are 5 mandatory questions that we ask for each individual, and I've listed them in the table below, as well as the response options that are currently selected from the dropdown. So first we ask, is the individual actively engaged in ADVP or ILOS? And that is a simple yes/no question. We track the active participants, so those who are currently receiving those services in the quarter of the reporting period, and then any new members get taken off or any discontinued members will be removed from our tracking. New members get added to this list. The second question is where we want to focus the majority of the time on today. I think this was a source of confusion for several providers. We ask, is the individual currently employed in an ADVP setting? The answers being yes or no, they are only receiving day services. The original intent of this question was to ask if the individual is being paid for their work in an ADVP setting, which we defined as a non-integrated. However, this wording wasn't clear, especially for some providers who currently offer employment to their clients at their locations, but the positions may be integrated in the community. They might be paid minimum wage and meet all the standards for CIE, so it's unclear how to answer those questions. We will dive deeper into this in the next slide. I see something in the chat about not using the acronym, so we can back up just a minute. CIE stands for Competitive Integrated Employment. So anytime we say CIE, that is what we mean. As you can see, Competitive Integrated Employment has 5 criteria, and we've listed them below. So there's 5 standards that need to be met for CIE. 1, they are compensated at or above minimum wage. They are paid comparable wages to employees without disabilities performing similar duties with similar training and experience. They are receiving the same level of benefits provided to employees without disabilities in similar positions. 4, they work at a location where employees with disabilities interact with individuals without disabilities. And 5, they are presented opportunities for advancement similar to other employees without disabilities in similar positions. So when we mention CIE, we mention a job that meets all 5 of these criteria. Now to back up for a second, the question that we think was providing a lot of confusion in our data was that top question, is the individual currently employed in an ADVP setting? We're going to be modifying the phrasing of this question in the next cycle to change ADVP to non-CIE and ask, is the individual employed in a non-CIE setting? So non-CIE is any employment that does not meet all 5 of the criteria listed on the left there. So if it meets 3 out of the 5, it's still non-CIE. If it's minimum wage, but they don't get the same benefits, it's non-CIE. It has to meet all 5 of those steps to be considered CIE. Next slide. So this slide shows how you should answer the 2 questions in the tool, which are listed in column Z and column AA for those who are responsible for filling it out. we really are trying to draw a distinction between the two types of work, CIE and non-CIE, and have these groups be clearly defined. So if an individual does not have any job, that first row, that means they aren't getting paid for their labor anywhere, then the answer for both these questions will be no. If they have one job and it's in CIE, meaning it's competitive integrated employment, then they should answer no to non-CIE and yes to CIE. If they only have one job and it doesn't meet all 5 of the criteria for CIE, then they should answer yes to the non-CIE question and no to CIE. And then lastly, if an individual is working multiple jobs, say they have one job in the community for a few hours a week, and then they work a separate job at the provider location in a non-CIE setting, then this is the only circumstance where both questions would be yes. Next slide. So here we want to continue on with some more specific example scenarios of how we would expect the tool to be filled out. We know there's lots of different situations across the state, so we want to make sure we're capturing every outcome. If you have a question about your particular scenario, please feel free to put it in the chat. And as a reminder, before starting any of this, any amount of hours worked is considered employment. So even if the individual is only working 2 hours a week, that's considered employment in both CIE and non-CIE. So anytime they're getting paid, that counts as employment, and that's how we want to record it. So the first scenario is an individual comes to receive ADVP or long-term community supports at a provider, and then they also work 5 hours a week at McDonald's. I think this is a classic CIE case, so we would expect the answer to be no for the non-CIE setting question and yes for CIE. So they're only receiving day services when they go to the ADVP. Second scenario, an individual works at a provider shop making minimum wage, but it's not in an integrated setting. So because it doesn't meet all 5 criteria, this individual is currently employed in non-CIE setting. So they should answer yes to the first question and no to CIE. The third scenario is an individual receives LTCS from a provider, but they also work at a 14C job at a different location. So this is the scenario that we have seen where providers may subcontract out either vocational services or places of employment with different providers. This is still considered non-CIE work if they're working a job that uses a 14C license. That's non-CIE work. So they should answer yes and then no to CIE. We also want to make a note here, I put an asterisk, that please note in either the comments or the places of employment if this situation is happening where the provider where the work is being done is different than the provider listed as responsible in the tool. LTCS is long-term community supports. It's another in lieu of service for the adult day vocational program. So we want to capture the information to know who is actually providing the ADVP services and who is actually providing the employment in this subcontracting scenario. So it's really helpful when you add that in the comments and describe the situation or the place of employment. So please continue to note where that is happening. The fourth scenario is an individual works at a provider location and the position meets the criteria for CIE. So this is also something that we've seen happen. And in this circumstance, we want the first question to be no, they are not working in a non-CIE setting. Yes, they are working in CIE. So their only job is a CIE job if this is the case. And then lastly, if an individual works multiple jobs, one in a community setting, one in a non-integrated setting, then this is the only time where yes should be answered for both non-CIE and CIE. All right, that brings us to our data summary. So I want to share with you all a current understanding of these different population groups and the work that we're currently doing to confirm our numbers. Lastly, getting to the population that's specified for this incentive program. So at the top, I want to start with our implementation MOA that we currently have. This agreement outlines the scope of activities that we're making as a program to advance CIE in North Carolina, and it includes a benchmark for our Inclusion Works program. So what we're trying to do for Inclusion Works is have 5% of the number of individuals with IDD, but no less than 50 employed only in non-CIE settings will be employed in CIE. So have those individuals start a job in a community setting that meets those 5 criteria. Now, more than 1/2 of these individuals will be from the 3 pilot sites in Project Spark. So we are doing a lot of work under Inclusion Works program, and we're tracking a lot of metrics, as I've detailed, related to our reporting. This is just one benchmark, but it is an important one that we're trying to hit. One reason why we're trying to get a clearer count of the population who are employed only in non-CIE settings. So many of you on this call may have been contacted by my team over the past week asking clarifying questions about your ADVP status, the type of employment being offered at your provider locations, and your responses have been super helpful in correcting some of the data in our system and providing a better understanding of our populations. So thank you to all who have helped out with that effort over the past week or two. To get into the data, if you look at the data as it stands today, which again, there is an asterisk on these figures as we're still figuring out the process of conducting this outreach. So these numbers may change, but this shows the breakdown of the different population groups based on the responses that we have in the tool as of May 31st of this year. So there are 1,744 total individuals tracked in the tool, and of that, 1,457 are currently active in ADVP or ILOS. So they are currently receiving that type of service at the provider locations. Of the 1,457, 534 are currently employed in a non-CIE setting, which we previously called an ADVP setting, and 923 are only receiving day services, so they're not employed at the ADVP. Of the 534, if we want to break that down further, 478 are not in CIE, while 56 are in both CIE and non-CIE employment. So this group of 478 individuals is really what I want to draw your attention to. This is the individuals who are currently working only in a non-CIE setting, and that is going to be the target group for this CIE incentive program. These are the eligible individuals, and these are who we will be sending lists out with member names to the tailored plans to provide the eligibility. This group is slightly larger than that 478 when we consider any individual who has worked in a non-CIE setting since November 30th over on the right there, since some of them may have stopped employment. But broadly, that's the criteria that we're looking at for this eligible population, this orange box. And it's the same group that will also be receiving an employment assessment and a career development plan from our partners in Work Together NC. They will be leading a new informed choice process that Mike will provide some additional details on later. So this wraps up the data collection updates. I will now pass it back to Claire to discuss the details for the CIE incentive program.
Thanks so much, Austin. That was a lot of information, and I'm sure people will continue to have questions for us, and that's great. We want those questions. We want to help answer those. So I want to talk a little bit about our incentive program. We're very, very excited about this. The CIE incentive plan for providers. So this is to support providers who are going to be supporting their members that are currently employed in the non-CIE settings and hopefully can begin and sustain a job in CIE when it is their choice. The 478 individuals that Austin just talked about, these are all people who have identified as currently receiving non-CIE work. They are not receiving minimum wage. They are not working alongside individuals who are not disabled, and they have indicated a choice to do that. So once again, these individuals have stated they are interested in CIE. The way this program will work is that providers will reach out and engage with their eligible members. When a person does start CIE, and again, Mike is going to talk more about that reaching out and engagement. But when a person does start CIE and the employment start date is submitted to the tailored plans, when the tailored plans and the state have verified that the CIE is happening, regardless of the number of hours, providers will receive the first payment. And that is the $2,500 payment to each provider for every eligible member that begins their job in CIE. This is like very exciting and innovative for us. We will expect that there will be proof of employment, and that will be verified. One thing we want to make clear as well is that if there is more than one provider involved, for example, sometimes there are various providers, the provider that is actively working with the individual to locate and maintain employment is the provider who receives that payment. So we're just trying to make that super clear for folks. And when the person remains in CIE for 180 days, at that point, again, the information is given to the tailored plan and the state, employment is verified, and at that point, the provider will receive the second bonus of $2,500 with a total of $5,000 received. We'll be doing tracking throughout all of this to see again where there might be gaps, where we can help providers figure out how to succeed with this, and that will be an ongoing process. So we're looking at also, this fiscal year, so these payments will be effective July 1st, 2024 to June 30th, 2025. For some members, they have already started CIE and they have not currently reached the 180 days. These providers will be eligible for the second milestone payment. So they wouldn't get the milestone from the beginning of employment, they would get it when the person has been engaged for 180 days. None of the people employed can be employed in a Spark provider location. So these are going to be separate from Spark. There is no hourly requirement, as I said earlier. No matter how many hours a person is working in CIE, the provider is eligible for that payment. And there is no requirement to leave non-CIE. For many people, their choice is to have both. They want to work in the community. They also want to stay where they are with the people that they're familiar with and have that job as well. So they can work in non-CIE and they can work in CIE. The provider will still get that payment. I'm sure there's going to be some questions. So again, feel free to put some of those questions in the chat and we're going to get to those as we go forward today. Okay, so the next slide. Just wanted to show you the proof of employment form that we're going to be using. So take a look at this form. It's pretty straightforward. Copies will be available to everyone, but we will be looking for proof of employment, such as a pay stub, to support the document. Tailored plans are going to submit this data to DHHS every quarter. So that's the form. It's, as I said, it's pretty straightforward, where we want to make this as simple a process as possible and make sure people get credit where it is due. And next slide. Okay, so this is a real high level look at our incentive payment process. I won't go into all the details again. This is available to everyone to look at more in depth, but it will answer some of those specific processes. But we want to just make sure people see end to end how this maps out, what it looks like. We want to make sure that people understand that each piece of this is in place in order for people to get the CIE payment process. Okay, and the next slide. So we've mentioned choice a lot today. And as you know, nothing works without choice. We want to make sure that we support the providers. We want to help all of you in this field in every way that we can. We need providers to tell us what is working and what is not. So in order to give you as many options as possible to communicate with us, we have monthly stakeholder meetings. I encourage everyone to attend these. It's one of the best ways we get to hear your voice. And these are held on the fourth Tuesday of every month at 11 a.m. and we really need your help. So think about that. A lot of you are also members of MARC, NCAPSI, and NCARF. This webinar came about in part today because all of you were asking for more information, and we really appreciate that. Thanks so much for your involvement and your commitment with your organizations. Our tailored plans also have a monthly stakeholder meeting with us as well, and we want as many people with the tailored plan to be as knowledgeable as possible. So if you are part of the tailored plans, please talk to your leadership and try to stay as involved as you can. We're also doing a lot of ad hoc work. We're meeting with individual providers a lot lately. Some of you have been part of this. And again, that information has been really valuable as we help to figure out what our data says and where we need to go forward. So none of this works if we're not all communicating. Our partners have been helping us to understand the process, to help us understand what works and some of the potential barriers. We also have lunch and learns every month, or every other month rather, on a variety of topics related to CIE and Inclusion Works. We want to continue to give you as many resources as we can. And if you have suggestions for lunch and learns that would help yourselves or people you know who are interested in working in CIE, please let us know. We would love to add to that. Every month, our webpage at DHHS, which is Inclusion Works, every month we have a community update there. We have other timely updates and information on our processes on that webpage all the time. It's updated frequently. So please bookmark it and pay attention to what we're doing there because it's really important. As we go forward, we're going to be continuing to refine and modify our plans and our solutions. And once again, stressing this a lot, input from stakeholders is just vital for that. We really want to encourage everyone to help us move forward with this important work. Mike is going to talk to you about some employment assessments. And I'll turn it over to you, Mike.
Thanks, Claire. So I know there's been a lot of people on this call who say they are new to IDD, maybe new to the employment process for people with IDD. And there's many of you on this call that have been doing it for longer than I have, and I've been doing it for a few decades. So I want to say that all this process is focused and has been created with a lot of information and a lot of support from providers just like you who are giving us your knowledge and your expertise, also with working with families. As Claire said earlier, we have lots of focus groups. We have been doing a landscape analysis, which was part of Work Together NC. We have lots of stakeholders, but it's your feedback. All these processes are still a living document. So this is the first layout that our groups have come up together with to sort of talk about how we go through this and help people make informed choices about what employment looks like. So we start with that very top box, sort of this employment assessment, which is why you're hearing an awful lot about that today. This is where we're going to start with every individual. And it's really just laying a groundwork for what does this person understand about employment, how employment could be helpful or could be something that they want to explore. And so we really want to understand their desires, their employment history, and sort of get a good feel for what they know about what it would be like for them to be in some type of employment section. So you're going to see parts of our team from Work Together NC, WISE, Inclusion Works, and Triangle Disability and Autism Services coming out and working with you to gather some of this information. It's our understanding and our process as we learn from you that this information may change, but we're trying to gather the information on every individual so that we can make decisions on the state level about where people are in our state. As we've seen in the last couple of weeks, the data we have has been a little challenging to go through. And we found out there's some areas where we can clean up our data. And so doing these assessments will help us clean up our understanding of where these people are in their employment process and their careers. As you see here from the top, we have two pathways a person can choose. They can say, I'm not interested in choosing CIE at this point for whatever reason. Some of the people I know in our data sheet are past retirement age. And so they have retired. And so they will not be pursuing CIE, just as many people who are retired are not in CIE. But for those that do choose to pursue it, are on the left, What we're seeing is they choose to pursue it. The next thing we're going to do is, after we gain some understanding of their knowledge and what they need and sort of what additional education or supports they need, we're going to develop a preliminary career development plan. And it's going to focus on all these big things that we talk about here. It's going to look about what services can help me. How do I enroll? If I'm looking at going through EIPD, which is the new name for vocational rehabilitation, employment and independence for people with disabilities. How do I enroll in those services, and what are those steps? It's also going to look at, are we making sure the person is making a truly informed choice? So many times people don't know all the options out there. And so we're really trying to see, how can we help expose them to all the different opportunities that come about from employment settings. And so we're going to explore those through a hands-on experience or exposure opportunity. It may be just going and visiting a site. It may be working for an hour or two. But regardless, we're going to take the person's knowledge and we're going to say, from everything they told us in this assessment, we're going to start by having them go to these 3 or 4 different job opportunities and just explore them and see what they get out of being a part of those job sites. They may go there just for an hour as an exposure opportunity. They may decide, or their team may decide, that they want to work there for a day or two to get a real good feel for what it's like. There's lots of best practices, and our team at WISE and the team with Work Together NC have some possible strategies for how to get the best results in terms of helping people really understand employment. And we'll share those when we come around and do a little bit more education for all the providers that are looking at doing competitive integrated employment. We also have some tools on the right that we're going to show you, that we're going to share with you about how to identify skills that people may have, sort of looking at tracking. Did they participate and how well did they do? And sort of evaluation of those skills, so that when it comes time for us to revisit this employment plan for a person, we look at it as an addendum to what may be a treatment plan, a person-centered plan. Regardless, it's a career development plan that should go alongside with the other goals that the individual has in their life. And like any sort of plan, it needs to be reviewed periodically. We're looking at it being reviewed at least annually and saying, are you still not interested? Are you still interested in looking at a job working in this particular profession? If so, what have we done? How have we done? And so we're really going to look at making sure we capture all that data that we talk about. The most important thing that we're going to make sure appears in all of our career development plans is there's some type of accountability. Who's responsible for what? So it may be that Mike is going to be the person that takes Johnny out into the community to look at this particular work site at ABC Accounting. And I'm going to make sure that I do that. And I'm going to make sure I do it before the first of the year. And that accountability helps us all sort of stay on track and making sure that we're meeting this progress and we're giving these people the opportunity for truly informed choice. Once again, none of this is new. It's all stuff that those of us who've been in the field for years do on a regular basis. We're just trying to put it in a nice flow chart for new people coming in, and so that we help our own staff sort of track this progress, as we realize that those of us who lead programs can't track everything. We have to have the support of all the people on the ground, boots on the ground, helping us make these dreams a reality. Claire?
Awesome. Thanks again, Mike. So next steps, what's coming next? We are going to be working hard on this data collection. As we've said a few times today, our data team is hard at work. A lot of you have been approached, giving us great feedback on the data. And as Mike said, we're really cleaning up that data to make sure it's as accurate and as helpful as possible. So there will be more data collection updates coming. There will be more emails from our team with more information available to you. There's going to be updates to the tool where we look at the wording and make sure it's clear what we're asking for. The tool is going to be distributed in December, and the next assistance call is going to be scheduled in early September. So you will probably be contacted if you're a provider, and hopefully can engage with us on that technical assistance area. The CIE incentive plan is rolling out. Allocation letters have been distributed to the tailored plans. They're going to be distributing emails on behalf of the state. with the full program details and all of the resources available. The Tailored Plans folks should be seeing that soon, and the rest of the emails will be delivered shortly after that. Our employment assessments have begun. They will be at select providers starting now and in September, following an I do, you do, we do approach. Work Together is working really hard on making sure these assessments get done in the best way possible and that providers can be trained at the same time. So there will be a collaborative attempt to get everybody able to do these best practice assessments and get the best information possible. And that's finally, stay involved with updates from Inclusion Works. Any of these QR codes can get you where you want to go. Register for the Lunch and Learns. They're every other month. Visit our website, visit it frequently, bookmark it, and join our mailing list and receive bi-monthly community updates. If you're a provider or a member or somebody working with Tailored Plans, please think about joining our regular stakeholder meetings every month. And I think we're going to look at this last, Austin, do you want to go through this last tool?
I think we're going to go into Q&A real quick, Claire.
Absolutely, we can do that.
Okay, we
Okay.
have amazing questions in the chat, and thank you to everyone's patience at the beginning while we had some audio fixed. So I'm going to try to get through as many of these as possible, but whichever ones that we might not get into, we'll be sure to try to continue to answer in the chat and send a follow-up with to this group, as well as looking at forming a frequently asked questions with some of these really great questions that I'm sure are going to continue to come up. So first wanted to address one. Somebody asked to please have some type of definitions and acronyms, since we do use a lot of acronyms. That's a great call out, Pat. I'll go ahead and add a slide at the beginning of this presentation that's going to be shared on our website with a kind of glossary of the terms that we use in this presentation. So again, just for everybody's reminder, that will get uploaded to the Inclusion Works website by end of day today or early tomorrow. So this is going to be where it's going to be posted. Under resources for care providers, there's an area called CIE Incentive Plan. Someone asked if one question on clarifying, are only ADVP recipients not employed with CIE eligible for the payments? So this is about the CIE incentive program. Claire, can you answer this question from Bob?
Absolutely. Can you repeat it again briefly?
Yes, it's are only ADVP recipients not employed with CIE eligible for the payments?
So anyone who is not working in a CIE setting, any non-CIE setting, including ADVPs, who is not making a competitive salary and who is not working in an integrated setting alongside people without disabilities is eligible for this program. If you are working in an ADVP for a wage, but are not working alongside folks without disabilities, then this is not considered CIE. And I would just, again, refer people back to that 5-point thing that Austin showed us earlier about what CIE requirements actually are. I hope that answers the question.
Mm-hmm. Great, thank you. Next question is, somebody asked, who provides the funding? And does the person have to go through VR, or can they go through B3 or 1959? This was asked by Kara Cody.
That is a great question. So the state is providing the funding. We are providing this as a way, again, to encourage people to help anyone who's interested in CIE to get to where they want to go. And tell me the second part of that again, Ashlyn.
Do people have to go do people have to go through VR, or can they also go through B3 services or 1959 services now?
Anybody who is not employed in CIE settings can go through any particular type of, there are lots of state funded settings and their tailored plan settings, can go through the process to get to CIE. So we want people to use what works. We want to help people get where they want to be with as minimum of stress as possible, if that helps.
Yeah, that's great. Amy Hartley had another question. Claire, I think this one will also be for you. Is, can a member have a community job for 10 hours a week and attend the ADVP program for the hours that they are not employed in the community. For example, client can work Monday and Wednesday at a Burger King, but then the client comes to ADVP program on Tuesday, Thursday, and Friday.
That's an excellent question as well. A person can work any number of hours in community employment. They can have all kinds of other meaningful day options, including other work at an ADVP setting or an ILOS setting. They can have other day activities that work for them, that their person-centered plan explains what a meaningful day for them is. Any number of hours in the community per week is absolutely acceptable, and the payment would be received.
Thank you, Claire. Also, I see somebody has their hand raised. Katie, do you want to come off mute to ask your question live?
Yes. Am I off mute?
Yes, you are.
Awesome. Okay, sorry. I have a couple of questions about operationalizing this. So I understand there's been a tool for competitive integrated employment data, and now we're kind of taking, 400 and so of those individuals, and we're going to be tracking their competitive integrated employment specifically. So is there a separate tool for that, or are we working off the original tool?
We are continuing to work in the same tool. And
Okay.
again, we're tracking more than just the 478. We're tracking the entire 1,400 people who are currently receiving ADVP or ILOS services.
Okay.
This program is focused on those 478 individuals who are only working in non-CIE settings. But we're going to continue sending the tool once a quarter, asking the same questions and collecting the same information.
Okay. And then you had mentioned that the individuals who were employed prior to 7/1 are not eligible for that first $2,500 payment, right?
Correct.
And then individuals who are employed, but they after 7/1 would be eligible for the first and second payment. So we are in the middle of August. So we potentially, just need to do a little looking back to, understand people's employment dates. Is there people on the list that have been employed greater than 180 days already? Like of those 478 people, are any of them already employed greater than 180 days? Or no, they wouldn't be on the list then, right?
They wouldn't be on that list.
Okay.
Our direction to providers is if you have somebody who started a job in the last 6 months,
Okay.
send us that form anyway with the start date, and then
Okay.
send us the update after 180 days that they've maintained it, and you would be eligible for that second milestone payment.
Okay. All right. Thank you. That helps clarify. I appreciate your time.
Great, thank you. We have somebody else with their hand raised. Bob, did you want to come off mute as well?
Yes, that'd be great. I had I'd sent another follow-up question. It said there were 20. So one of the slides said there was 527 people eligible. Who exactly are those 527? Because I mean, I guess at our day programs, we have very few that actually get the ADVP service, but we have a lot of people who are interested in working competitively. So if they go from just attending and receiving like CLFS, LTCS type of service, and then get employed competitively, would they be eligible, or do they have to start with the ADVP? Because we have very few ADVP remaining.
Yeah, so for the purposes of this program, those individuals would not be eligible. That's absolutely a story that we want to tell and that we're highlighting in our reporting. Individuals who are just receiving CLFS and then find a job in CIE through that data collection tool, we want to highlight that accomplishment. For the purposes of this reporting, we're only focused on, or for the incentives, we're only focused on those who are currently working jobs in non-CIE settings who then start a competitive integrated employment job. So that's what those 527 are. Those are the individuals who, since December 1st of 2023, at any point were working in a non-CIE job.
Okay. Thank you.
Thank you for answering that one. Wanted to hop back to some of the questions that were in the chat. I'll go to the hand raises shortly. So one of the other questions that came through the chat was, can this process work with home health services? So you have to have certain qualifications in place. Question. Not sure if somebody on can answer that, or if this is a question that we can follow up with afterwards. Or if that person wants to come off mute.
I think that might be one we'll take back. If you could leave your information with us. I don't want to answer. I want to make sure I'm answering your question fully. So if you would leave your information for us, and we will post all our responses to these things as well. So thank you very much for that question. It's a good one.
Great, thank you. And then I see Marilyn Rains has her hand raised. She did ask a question in the chat about, is vocational rehabilitation a provider who refers clients? Marilyn, did you have an additional question that you wanted to raise?
Yes, I thank you for identifying both of those questions. My question is, I have a daughter, I'm a parent, and she's been working with vocational rehab / integrated placement, specialized placement services over at UNC, and she's been working almost a year now. And the qualified CIE, services job, she's very capable, high functioning. So could she be eligible for your program? Because I've never heard of it. Vocational rehab has been like, trying to agree to, I'm sorry, I don't want to be ugly. They've been very, very uncooperative and slow, and it's been really hard for her. So I don't understand. She's been trying to get accelerated to a higher level of work. She's got a college degree. And so, but they kept saying, you be here, be here, be here. And she's struggling mentally and emotionally and physically. So would this be an incentive to help her stay engaged and stay incentivized to be in a work setting that she wants to work? She doesn't get any services. She's not Medicaid. She's not Taylor Plan. She's not none of that.
So did you say that she is currently working in a job for pay?
Yeah, she's minimum wage. She's
Okay.
is very limited income, but she got a little bit of raise and she lost her food stamps. So I mean, wasn't that much, but I'm just saying this incentive program would be a great encouragement for her. She doesn't want to be stuck at minimum wage. She's got a college degree. That's all I'm concerned. Can she get elevated? Does this program would incentivize her to get to another level, I believe.
These are great points. Since she is currently working in a setting where she is integrated into the community and making a competitive wage, this program would not incentivize, would not be available to her providers. However, we hear you loud and clear about your frustrations and what you're trying to accomplish for your daughter. And I think, again, if you would leave your information for us in the chat, and we can forward that on to people who would probably be able to help you more specifically.
Well, I appreciate
I really appreciate you bringing that up to us.
Thank you so much. I appreciate it. I'll leave it in the chat, and I appreciate your time, and it's a great program. Thank you for doing this.
Thank you so much, Marilyn. A follow-up question was, Cindy Harrell asked, how does this affect enrollment in traditional VR services? And somebody had a question about the assessment process coming from VR. Does VR work with the members finding jobs and job coaching? So Michael, maybe you can take that about, a little bit more about the VR connections.
Yeah, so EIPD / vocational rehabilitation are going to be a partner in this. State law sort of says that before we use Medicaid funding to provide supports to someone, which is what a lot of 1915 IOLS services are based upon, we should seek vocational rehabilitation services first, or EIPD. So we will be, as part of that preliminary career development plan, we will be saying, do you have an open case with vocational rehabilitation? And is that something we still want to pursue? So we'll be reaching out to vocational rehabilitation counselors and having them be a part of this process. They will probably be doing their own vocational assessments, which are going to be different than ours. Their vocational assessments will be geared around the career development plan. They won't be that initial sort of interest in terms of, are you interested in CIE and what's your understanding and education about employment? That's that first assessment we're talking about. But what EIPD long-term vocational support, support employment, all those services that come through our MCOs can be used to help someone obtain employment. And that's what we're sort of looking at, being able to access all those array of services. So that career development plan is going to be researching what's available to me. And that's going to be where it comes from. And what can I access to get me where I want to be?
Great. Thank you so much, Mike. Michael, maybe I see that you've had your hand raised very patiently, so I wanted to see if you wanted to come off mute and ask a question about today's presentation.
Thank you, Ashley. And thank you to everyone putting this on today. We really appreciate your development of this service. Just one quick point to Marilyn Rains, who asked a question a minute ago. If she is having some dissatisfaction or difficulty possibly with receiving the VR services she thinks she needs for her daughter, she should contact the Client Assistance Program, the CAP program, which is kind of the oversight body for VR services, the Client Assistance Program, and they may be able to help you, Marilyn. The question I have gets a little bit in the weeds. It's for ILOS providers, mostly in the VIA area. When someone is in a residential service, the group home service, ILOS pays for the group home service. The LTCS, long-term community support, pays for the group home service, and the group home provider contracts with the day services provider. So a group home would be the one getting paid by VIA for the service, and then the group home then pays the day provider. But the day provider is going to be the one almost always doing the CIE. So is the payment going to go from VIA to me if I do CIE for someone who's in a group home service when the group home's the one getting the payment? Do you follow that, Mike?
100%. Thanks, Michael.
Yeah.
So I want to, again, mention that while this program is set up for payments to go through the tailored plans, I want to also make sure that people understand that the person, the provider doing the work, getting the person employed, helping them maintain employment, that is the person who will be reimbursed for these funds. There are some issues, and we talked about these before, Michael. We need to work with our friends at the LMEs to make sure this is set up and administered correctly, and they are partners in this. They are really excited to be doing this with us. So we want to make sure that everybody understands the provider who does the work and helps get that person employed is absolutely the provider who will be getting paid. I hope that clears it up, but I appreciate that question so much.
Thank you very much, Claire. I just wanted to make sure that that was out there for all to hear. And again, thank you guys for what you're doing.
Thank you so much. And I know we're coming to time, but wanted to go ahead and Carol, I know you've also had your hand patiently raised. And I know we haven't gotten to all the questions in the chat, but like I mentioned, we'll try to get those responded to and share those after the session. So Carol, please feel free to come off mute and ask your question. Okay. All right, looks like no longer have that question. I think another interesting kind of more about some of the logistics, it's what is the point of entry for tailored plan members for CIE? It seems to be through tailored plan or tailored care management who refers to ADVP providers who give the CIE assessment. Does that sound correct? So just getting a little bit more clarity on the point of entry for tailored plan members for CIE.
Sure. The entry point starts with the assessors, with the providers, with our partners who are doing these assessments and across the state. That's where the entry point starts. And then the person is linked to the providers who can provide that service, and the tailored plans will be part of the assessment and part of the linking to services. So I hope that helps. All the people involved in a person-centered plan would be assisting with this. There's no set entry point.
I just want to sort of say that competitive integrated employment, quote, is for everyone. Okay. And so as we talk about this, when we talk about this particular project, we are focused on a very small subgroup of that. And those are those people that have traditionally not been as successful at obtaining it, or who are currently working in non-competitive integrated support non-competitive integrated employment settings. And so this project, although it can have impacts across all of CIE in the state of North Carolina, its initial focus is on that very small subgroup. But our hope is that when all this is done, that the processes, the plans, the things that we create are something that will roll out for employment for everyone who's interested.
Thank you so much, everyone. Well, I know we weren't able to get to all the questions, but we will work on answering those and send it out in a frequently asked questions document and also have that uploaded. But there will be a lot more clarity around this whole incentive program, the employment assessments. This is kind of just a intro. That information will, again, be coming directly from the tailored plans to the providers, as well as all of the eligible members. So each provider will receive a list of those who are eligible for the program to just really, not find any confusion in this process. But we thank you all so much for joining us today, and thank you to our speakers. But with that, just wanted to thank you all for being here again.
Thank you, everyone.
Yep. Thanks, everyone. Look forward to seeing some of you soon.